Hello, my name is Michelle Rohrer. I'm a student physical therapist from the University of St. Augustine. Could I please have your full name and your date of birth?
Andrea Leilani Rohrer, February 22nd, 1986.
Thank you. Can I please verify that on your wristband?
Yeah.
Thank you. Okay, Andrea, go ahead and relax your wrist for me. So, I have read through your chart and you are diagnosed with acute carpal tunnel syndrome. Is that correct?
Yes.
Of your left wrist, correct? I mean, your right wrist.
Yes.
Okay, and you've been experiencing pain and swelling. Is that correct?
Yes.
Okay, so the treatment that we're going to be doing today is called cryotherapy. It's also known as cold therapy. And the reason why we're going to be doing this today is to help decrease your pain and decrease your swelling. The type of ice therapy we're going to be doing involves an ice cup here. And now we're going to be using this ice cup because since it's such a small area, the ice cup will be very specific and will target that area very well. Okay? Now, the benefits of using this type of therapy, ice therapy, is that it will help reduce tissue metabolism, reduce your pain and inflammation and your swelling. Okay? Now, what also should be noted is that this therapy is going to be for 10 minutes, and we are going to put a nice little pillow underneath to help kind of promote the blood flow from that swollen area, and also have a towel underneath to catch any of the water there. Okay? So now, in addition to that, we should go over what are some precautions and also maybe contraindications to this type of therapy. So precautions would be if you had any type of impaired circulation or if you had hypertension or open wound, okay? Now the contraindications would be if you have any type of allergy to cold. We call that cold urticaria. And we also wouldn't do therapy. Another contraindication would be peripheral vascular disease, or if you had compromised circulation, okay? All right. So now another thing I should go over with you are the physiological benefits of ice therapy. So in terms of your swelling, it's going to help reduce the inflammatory chemicals from being released that typically cause swelling, okay? And now we're also another physiological effect would be that it's going to decrease the afferent nociceptive input. In other words, it's going to prevent the signals of pain coming from your wrist going up to your brain to help reduce that pain, okay? Alrighty. Now, another aspect we should go over would be that we would have a call bell here so that if at any moment during the therapy, if it gets painful, you just ring the bell, okay? Now, another aspect we should go over is let's see this area of your skin. Let's see if there's any open wounds or rashes. So we're just going to look all the way around here. It appears there are no open wounds and no rashes here, so we can proceed. Now we could also proceed by testing her sensation using a cotton swab. So Andrea, I'm going to take this swab and test it on my face. This is what it feels like. Can I test that on your face? Okay, can you say yes when you feel it?
Yes.
Great. So now I'm going to go ahead and test it on her uninvolved side. Can you go ahead and flip your wrist for me? Great. I'm going to go like this. Say yes when you feel it.
Yes. 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 Yes.
Okay, great. So now I'm going to test your involved side. Can you close your eyes for me and look away? Great. So say yes when you feel it and don't guess.
Yes. 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 Yes.
Okay, great. Thank you. So that was testing your light touch. And now I'm just gonna also be testing how you react to temperature, just to see if you react to that. So we're not going to be using the ice cup per se directly, but we're going to just use it to test. So what I'm going to do is I'm going to put it on your uninvolved wrist. I just want you to say yes when you feel it, okay?
Yes. Yes.
Oh, you could open your eyes. Sorry. Open your eyes.
Yes. Yes.
Okay, great. Now we're going to test her involved side. Close your eyes again, look away from me, and say yes when you feel it, and don't guess.
Yes. Yes. Yes.
Okay, great. Go ahead and open your eyes. Awesome. So that confirms your light touch and also your temperature testing. It's very important we do that before we proceed. Alrighty. Now, another thing that should be noted is that how would we reassess to see if this therapy worked for our patient? We would utilize a tape measure. I'm not going to do it per se on her, but this would be a girth measurement that we would do on her wrist before and after treatment to see if there is a reduction in swelling. Then we would also assess for our pain using a pain visual analog scale before and after treatment to see if there is any change in her signs and symptoms. Okay, so now we went over the call bell. Remember, you're going to put the call bell here so that at any moment this treatment becomes unbearable, you just ring the bell. Perfect. Okay, now do I have your consent to begin treatment?
Let's do it.
Okay, great. All right. So I'm going to go ahead and put this underneath here, making sure to not stretch the wrist at all. Putting a towel here, make sure we get that. Okay, great. Okay, so now we're going to rip the ice cup here, and we're going to do this for 10 minutes, and we're going to do longitudinal strokes and also circular strokes. How are you doing?
Fabulous.
Great. Don't forget to ring that bell if you need anything, if this becomes intolerable.
Doing great.
Doing great. Okay, just kind of dabbing the area, making sure we don't get the whole pillow wet. Okay, we're gonna fast forward and say that 10 minutes have passed. All right, let's clean the area. How are we doing?
Great.
And it's gonna remove the call bell. All right, let's go ahead and assess the area. Let's assess her skin here. Let's see that there are no burns. It's normal for the area to, be a little bit red after doing ice massage. But as here, there is no burns or open wounds or any rash of any sort. Are you experiencing any pain right now?
No.
We would use the visual analog scale for that aspect. We would do a girth measurement also as well. We assess that, okay. Now, we also assess the skin, making sure the skin is intact. Okay, great. Now, we would also talk about a follow-up intervention for this. Before we do that, let's assess your sensation real quick, just in case. We're gonna do it the same way, okay, that we did before. Look, perfect, yes, look away. Say yes when you feel it.
Yes. 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 Yes.
Great,
Yes.
perfect. Go ahead, open your eyes. That was just a safety measure, just to make sure that her sensation was still intact. Very important. Now, let's talk about the additional interventions we would do. We must consider our patient has acute carpal tunnel syndrome with swelling and pain. So, a good intervention would that be active range of motion. I will go ahead and show you a passive range of motion, just to help decrease the swelling and the pain. Go ahead and do that on your own for me. Great. All right, that concludes our video. Go ahead and relax. Thank you for being with us today.